Good evening. We'll start in some time. Is it audible and visible? Hello. Is it audible now? Good evening. Is the screen visible?
Yes, sir.
So, welcome to week 6 of global healthcare and role of non-profit organizations. In this week, we have the Measles Initiative, Global Progress in Disease Elimination, mobilizing the global funds to fight AIDS. Then we got integrated approaches to disease prevention and control in low-income cities. We also have the vaccine delivery innovations and epidemic preparedness, strengthening the public health infrastructure for epidemic preparedness. We have another title which includes global collaborations for eradicating neglected tropical diseases, NTDs. Then we have empowering communities through health education and disease awareness. So the first topic includes the introduction of measles as global impact, the burden of measles, how the measles elimination program was undertaken, what is the role of NGOs or NPOs, then collaborative efforts against measles, and progress in measles control. So measles, it is a fight against a deadly virus. Measles is a highly contagious virus. Excuse me. That's right. So measles is a highly contagious viral disease that spreads through the respiratory droplets. It primarily affects children, causing symptoms like high fever, cough, runny nose, red eyes, and a characteristic rash. Complications also have pneumonia, encephalitis, and blindness and death are common. So, especially in young children and malnourished populations. The disease is preventable through vaccination, which has made immunization a cornerstone of global health efforts. So, despite this, measles remains a major threat in the regions with limited healthcare access and low vaccination coverage. So, early recognition and prompt action are essential to prevent the outbreaks and save the lives. So, let's try to see the persistent threat. So, approximately 207,500 children die each year from the measles, with the highest mortality rates in the sub Saharan Africa and South Asia. So, poor immunization coverage, widespread malnutrition, and limited access to healthcare are the key drivers of such prevalence. Outbreaks places immense strain on already overburdened health systems, so increasing the hospitalization and disrupting the routine services. The disease disproportionately affects children under the 5 years of age, who are more vulnerable to the severe complications. So, understanding this burden highlights the urgent need for targeting vaccination campaigns and improved health infrastructure in high risk regions. So people are hesitating to get the vaccine, and there is a widespread misinformation that the vaccination may have side effects. So these kind of misinformation or false claims has to be The rumors should be stopped. So the information and awareness has to be created, and due to which low immunization rates are there. So parents may refuse vaccines due to the belief that autism and side effects may catch up, even though extensive scientific evidence shows that there's no link between vaccines and autism. So these misconceptions spread rapidly through the social media communities, undermining the public health efforts. Addressing the vaccine hesitancy also requires trusted community leaders who should take voluntary efforts in order to communicate with all the public so that it becomes a culturally sensitive education campaign. So healthcare infrastructure also, what is in remote areas, that is has to be developed in terms of medical supplies. So poor transportation networks are limited with the cold chains, and it makes difficult due to inconsistent or infrequent kind of supplies. So people are often affected due to political instability or preventing time vaccination. So the local governments have to make sure that there is a consistency in equitable distribution of all the required supplies. And the role of government is basically vaccine distribution. Governments play a central role in measles elimination by establishing a national immunization program and ensuring that all the information has to be sent along with the vaccines. They organize mass vaccination campaigns at various places, monitor coverage through the surveillance systems, and give them certificate that they are covered. And healthcare infrastructure in underserved areas also have to be taken care of. Governments also collaborate with international agencies like WHO and UNICEF to access the technical support and funding. Making vaccines affordable and accessible, governments will help ensure that every child, regardless of income, location, receives life-saving protection. And we see that more and more NGOs in the health area are providing their efforts in the marginalized population. They conduct mass vaccination programs, and governments inside, in return, give them subsidized medicines, and especially in conflict zone and rural areas where services of the government may be weak. So community education NGOs play an important role in combating the misinformations and building trust amongst the population. They manage the logistics such as cold chain maintenance and vaccine distribution. Additionally, NGOs advocate for policy changes. So updates in policy and any increase in vaccination numbers. So over a period of time, you've seen the vaccination numbers have grown significantly over the last around 20 years. So the global partners are helping them in order to have access to the equity, and their agility and local presence makes them indispensable in public healthcare efforts. Global collaboration, such as mass vaccination campaign, will help them to have outreach in the communities with mobile clinics, and children will be able to save significant number of years in facing that kind of troubles in case if they don't have. So outreach programs are important. Outbreak response and monitoring, that trace contacts, that how many types of people have come in touch with them, because since it is a contagious disease, surveillance systems will also help them to often monitor and track progress and refine the strategies over a period of time. So the constant monitoring and consistency is required for the teams to have the rapid response teams work all the time. And impact and progress in the year 2000, that is 25 years ago, measles related deaths have dropped by over, say, 84%. So globally, measles have been reduced significantly. Millions of children have been vaccinated. Significantly, number of risk of outbreaks has reduced. Health systems in many countries have strengthened, improved surveillance has been done. Trained personnel, people are there. They know how to take care and give the vaccination. Better supply chains, they have improved in cold storage. Public awareness also is increased in order to how much of vaccination support is needed. These achievements are a major step towards achieving the Sustainable Development Goal number 3, which aims to reduce the child mortality and ensure universal health coverage. And the case which we normally come across with very recently is the 2022 Nigeria's measles outbreak. In year 2022, in the country of Nigeria and Africa, and the measles outbreak affected around 1 lakh people. The outbreak was fueled by low vaccination coverage in rural areas and misinformation about vaccine safety that led to the Nigerian government, which has partnered with the WHO and UNICEF and the Measles Initiative to combat the nationwide uh, you know, trouble which they faced in 2022. Mobile clinics reached remote places, and community health workers have also educated the parents of the children. By the end of the year, 1.2 million children were vaccinated, and outbreak was contained over a period of time. So this case highlights the importance of rapid response and community trust. in controlling the outbreaks. Another case is Bangladesh's cold chain breakdown because they didn't have places to store the vaccine. So in this case, it was supply chain disruption. So in 2021, Bangladesh experienced a breakdown in its vaccine of cold chain during monsoon season, leading to spoilage of thousands of measles vaccines. So this resulted in significant drop in immunization coverage in the rural districts. The government, with support of NGOs like Gavi and the solar-powered refrigeration units and trained local staff who are inducted, this incident underscored the need for resilient supply chains and regular maintenance low resource settings. So, with the help of solar energy and cold chains, they were able to significantly store that for longer period of time, as recently 2021. Within India, there's a vaccine hesitancy challenge. People are hesitant in order to get vaccinated, especially in rural areas, and they are conservative communities. They are not well informed, that they think that it may lead to autism and certain other disabilities, and that was the reason behind declining immunization rates. The government responded by launching a nationwide awareness campaign, which featured trusted local influencers. So people have the banners and all the people, including religious leaders and health workers and all the social workers. They started have the spread news spread over a period of time, so that home visits was also responsible in various communities, that the workers were able to address those concerns. By mid 24, measles cases dropped by 40%. So, both health, culture, languages will play a part in order to overcome such kind of a hesitancy. So the poll question one: which factor is a primary driver of measles outbreak in many regions? A. Excessive vaccination coverage. B. Vaccine hesitancy and misinformation. C. Over-reporting of cases. D. Higher urbanization. Can anybody answer? Okay, people are telling B. Yeah, B is the correct answer, but here it is not written. We'll go slowly. Yeah. In the next question, I'll come to first that, then it is written. So, what is the most effective strategy for rapid measles outbreak control? Increasing hospital beds, mass vaccination campaigns, limiting the international travel, or increasing the antibiotic use? Any idea who has written? Yes, anyway, we'll see the answers. So, vaccination hesitancy, B is the correct answer. Those who are given B is the correct. And the misinformation is responsible. Explanation: false belief systems. People have false beliefs, and there is rumor. So, in order to overcome these false beliefs and rumors, that lead to hesitancy in the immunization rates, leading to outbreaks. And the second answer is also B: mass vaccination campaigns is what is required. So, rapid immunization increases the herd immunity and controls outbreaks. Now we'll go to the second aspect of the topic for today, that is introduction to Global Fund to Fight AIDS and HIV, Partnership for Health Equity. So we'll see global burden of HIV, barriers of combating, role of Global Fund, NGOs efforts, local efforts, partnership with health equity, and global progress for fighting AIDS and HIV. So, what is HIV and AIDS? It's a human immunodeficiency virus which attacks the body's immune system. So, specifically the CD4 cells, which help fight off infections. As a virus progresses, it weakens the immune system, making individuals vulnerable to serious infection diseases. AIDS, that is acquired immunodeficiency syndrome, is the final stage of HIV infection, diagnosed with the immune system is severely damaged. So HIV/AIDS remains one of the most persistent global health challenges, especially in low and middle income countries where access to healthcare is limited. The disease spreads through unprotected sexual contact, blood transfusions, and mother to child during childbirth, or even sometimes breastfeeding as well. So early diagnosis and treatment are critical to managing the disease and prevent transmission. So it's important to get tested because HIV testing and counseling are essential first steps in managing the disease. Early detection shows individuals to start treatment properly, which significantly improve life expectancy and reduce the risk of transmission of disease. In many regions, stigma prevents the people from seeking testing because they are isolated. So, counseling helps for individuals to understand the status and importance and adhering to the treatment plans. Access to testing is often limited to rural or underserved areas, highlighting the need for mobile clinics and digital health tools. So, people have to popularize this and not only test yourself, but people who are around you can also get tested. Many don't show any symptoms, so testing is the only way to know whether they are completely healthy. Barriers for testing are funding and training. People in global fund supports, they are having scaling up of testing, although it includes training and deploying mobile units, but public awareness may be less in certain areas. They think that only certain people are getting, but it's always better to get tested. Community outreach. So local health systems often lack trained personnel to conduct HIV testing and provide counseling. The Global Health Fund or the Global Fund, which fights against HIV, helps build capacity by funding training programs for all the nurses, community health workers, and outreach staff, all people involved in the handling the healthcare systems. So we are having the antiretroviral therapy. So viral suppression is happening here. There is viral load before ART, antiretroviral therapy, and after the viral load. This is a sample in which detectable level and undetectable level both are there, but viral suppression has happened. So ART is a combination of medication that suppress the virus and allow the immune system to recover. In many low-income countries, ART is a life-saving and can reduce the risk of transmission by 90%. However, access to ART is often limited due to cost, supply chain issues, and lack of awareness. NGOs and Global Fund work together to ensure that patients in remote areas receive consistent treatment through community health centers and mobile clinics. And as far as global prevalence is concerned, over 38 million people worldwide live with HIV, especially in sub-Saharan Africa, having the highest number of cases. So virus spreading primarily through unprotected sexual contact, and second cause is mother to child transmission, and third is contaminated blood products whereby they use syringes of one person to another. These are some of the these are the factors which are contributing in sub-Saharan African regions. In some regions, transmission rates remain high due to limited access to prevention tools like condoms and pre-exposure prophylaxis. Okay, so they are having tools which they are not used to. So stigma and lack of education also contribute to delayed diagnosis and treatment. The epidemic disproportionately affects the women and adolescents and the marginalized population, including people living with disabilities and those in poverty. So addressing this requires both medical and as well as social interventions. So this is a sample whereby people having a campaign in which all the people have to take care and fight against the virus, HIV virus. So countries like Nigeria or even South Africa have higher rates due to social, economic, and structural factors. They don't have the time or the needed resources to go out to the cities. Also, the region faces challenges due to healthcare infrastructure and gender inequality and high rates of teenage percentages or pregnancies rather. So this has been quite severe in the last few decades. So without targeted intervention, the epidemic will continue to strain highly fragile health systems. Now, prevention strategy, of course, ART and male circumcision and PrEP are some of the things. But then, whichever is preferable, they go in for those who are affected. So, prevention efforts include promoting safe sex, using condoms, and distributing condoms and implementing voluntary male circumcision, and has been shown to reduce the transmission by up to 60% in some studies. Community-based intervention. So even when they in the group in the adolescent ages, this is the example of Kenya, whereby Global Fund supported the introduction of what is a condom and why sexual health education is important in the schools, leading to 25% reduction in the infections among youth in Kenya. So these programs also reduce stigma by normalizing conversions about conversations. They can have at least conversations as to what is likely to happen if they don't use these tools. So when combined with access of testing and treatment, such initiatives create a comprehensive approach to HIV prevention. So key barriers are limited healthcare infrastructure is one barrier. Second is social stigma, and third is high treatment costs, which some people cannot afford in low income areas, and weak public healthcare systems, which are acting as a major obstacle. So, infrastructure, health system, social stigma, and treatment costs. All these factors, in a way, are barriers. So, in many rural areas, there are no clinics and trained staff to deliver such care. Stigma prevents people from getting tested or seeking treatment, especially among women and LGBTQ communities. In some countries, antiretroviral therapy costs more than a family's monthly income. So, if you spend the entire monthly income, also, some people are not able to get the ART costs covered, so making it unaffordable. So poor surveillance systems make it hard to track new infections and monitor treatment access. So these challenges highlight the need for integrated and community-driven solutions that go beyond the medical treatment or the social and economic factors. So one is nobody wants to be judged upon by somebody else. So they dislike people talk about them. So fear of social judgment and discrimination is a major reason why people avoid testing, and they don't want to disclose their status if it turns out to be positive in some cases. So this stigma often comes with the cultural beliefs, misinformation, lack of education. In many communities, HIV is seen as a moral failing. Okay, people link it to the moral behavior, and rather than treating merely as a medical condition. So in order to get rid of this, people have to create protection and take out the people who are in despair, and they have to reduce any transmission to other people. Community led education and peer support groups are essential in changing these kind of perceptions. So, impact of stigma has to be taken care in those places which are affected. Breaking down the stigma. One, community education, NGOs and global funds have launched stigma reduction, causing low, using local languages along with radio and television and social media to normalize HIV conversation. So people do not get offended, and moral policing is not done unnecessarily because people know that this for the healthcare purposes. And peer support networks, radio dramas are also conducted, street shows or road shows are conducted. Community theaters have been effective in rural areas where people trust local voices more than official health messages. Then peer-led awareness campaigns like Stop AIDS, Stop Stigma. So some kind of red ribbon clubs are formed at various places in the world, and people have to save the lives. They have, for instance, in Uganda, a country in Africa, the peer education initiative led to a 40% increase in testing among youth. So many people go and test themselves, uh, no matter whether it, uh, they come up with positive or negative, but knowing to keep themselves protected from the HIV virus is all that movement or the kind of empowerment which the people want. So this kind of promoted sharing and responsibility for the society has to be taken in order to fight this kind of an epidemic, which is known as a peer-led awareness campaign. So how the global fund drives we have known. So again, of course, this is repeat. The global fund is nothing but supporting financially to all the countries and the governments in order to scale up their HIV prevention and treatments and toolkits and care programs and campaigns. It strengthens the health system by funding infrastructure, training healthcare workers, and improving the supply chains. The fund ensures the transparency through regular monitoring and evaluation, allowing countries to track the progress and adjust the strategies. It also offers technical assistance and also research support, because the research also is significantly important to know the coverage and levels of coverage and the outcome. So, best practice is also needed to improve the effectiveness of the program. Importantly, the Global Fund also does not deliver services directly, but enables the government. It is an enabler for the government. It is finally the government which acts upon all the fundings, and NGOs also will get their share to implement those strategies, and the supplies are dealt with so that locally adapted programs can reach the most vulnerable populations where it is most needed. So, Global Fund. closely works with the national governments and aligns with the local priorities. This ensures that it effectively and efficiently reaches those communities where it is needed the most. Through regular reviews and performance assessment, the fund helps to countries to improve the service delivery and accountability. And impact. So, the technical assistance and innovation, the support, the fund supports innovation also. So, a lot many innovations of lower dosages or fast reaching and improving upon the digital tools and community based monitoring systems over a period of time to track them, uh, to improvise upon their outcomes is also important. Technical assistance innovation, and then monitoring and evaluation. So through the technical teams, the Global Fund helps the countries design the programs culturally appropriate for the such. For example, in Rwanda, which is an African country, the fund supported digital platform. They have also started digital platform that tracks the patient adherence and alerts healthcare workers, and then follow up is done as per the alerts received by the WhatsApp or SMS. So reminders are also set so that monitoring and evaluation can happen. And more importantly, data driven decision making is important because almost, you know, people are taking the help of women leaders also to sometimes, because 45% of small business in Uganda are owned and operated by women. The smaller businesses are owned by women. So Global Fund for Women also has come up. And the Global Fund uses real-time data to assess program performance and identify the gaps. This allows for timely interventions, better resource allocation. For instance, in Ethiopia also, data revealed that certain regions had low treatment and adherence. So it prompted them to target the outreach campaigns, and this data-driven approach helps them to accurately know how many people are really covered and how much of money is required to cover them, and what kind of measurable health outcomes have been able to be counted in order to improvise the overall society's conditions. So data-driven decision making and Global Fund for Women also has been started. And more importantly, NGOs and local efforts, the community-based organizations, we have the ground level. So change has to happen at the ground level through counseling, support adherence, and antiretroviral therapy. So antiretroviral therapy, which is expensive in some cases, as we have already discussed. So they have to run the awareness campaign to reduce the stigma and promote the safe behavior. So that is what is important. Not only reduce the stigma, but also to improvise upon the safe behaviors of people, that in the future they should not commit the same mistakes again. So many NGOs work in partnership with the Global Fund to implement funded programs. They are especially helpful for reaching marginalized populations such as women, youth, and people in rural areas and conflict affected areas. So by building trust and understanding local needs, NGOs ensure that interventions are culturally sensitive and sustainable. So we see the examples of mobile healthcare unit or the mobile units, which have the staff that people have to be trained and they have to talk the local language and understand the cultural norms under which the action have to be taken. They provide a safe and confidential space for people to get tested and receive care without fear of judgment. And from service to system change, service delivery, NGOs also advocate for policy changes at the national level. So NGOs will have to draw out their own policies. They should have the procedures, processes across for all the treatments and terms and conditions under which it has to be taken, so that it becomes binding upon the people to know the rules and regulations and the laws thereby. And policy advocacy in India, NGO launched a campaign to provide the free ART and to provide therapy to women in rural areas, resulting in 30% increase in the treatment undertaken by women. So community trust and engagement is what is increasingly found to be important, because it's a movement which helps them, not just the information provided by doctors or nurses, but the community trust and engagement has been able to overcome this kind of a challenge. So in South Africa, which is an African country, a local NGO trained the women as peer counselors, leading to 50% increase in testing among young women. So these peer counselors are often similar background, which builds the trust and encourages open conversations about health. Why partnerships are essential? Because they are the ones who are working alongside the UN agencies and NGOs and governments in order to take the private sector along with them in order to pool the resources. So everybody doesn't have resources. Some have knowledge, some have tools, some have uh, you know, vehicles, some have remote access. So all of them have to share the information in order to build partnerships to ensure that vulnerable populations such as women and children and LGBTQ individuals and people in poverty are not left behind. By combining financial support with technical expertise and community trust, these collaborations create scalable, sustainable solutions. So, health equity is not just about access to treatment, it's about dignity. Okay, so mechanically giving treatment is one thing, improvising upon their dignity, their inclusion, and providing them all the required care for social justice is what is important. And we've seen some areas, people don't have hygiene or something, like they don't have basic like water, or sometimes three times food or two times food is unaffordable for them. So in a country like Zambia, a partnership between the government, the Global Fund, and the local NGOs, that 60% increase in the ART coverage was done. The local collaboration included joint planning, sharing, monitoring, coordinated outreach. This model was replicated alongside various areas in Zambia. Now, building resilience through collaboration. Resource pooling is one thing. So, pooling of resources is one thing, as we discussed, because all the institutions will not have everything. Some institutions are good at having something, so they have to pool the resources. And then shared learning is also required. So, expertise is being concentrated with people who are highly educated, like doctors or researchers or authors. They have written some books and they have to share through writing various blogs or making YouTube videos, or joint grant is required to outreach program with the Global Fund, with the UNH program, helping launch a national testing campaign in Malawi. Okay, so it was understanding of a few cases in some countries. So building resilience through collaboration. The ripple effect, or another NGO, Ripple, is a company which is collaborating for a stronger response in Kenya. It is working with the Ministry of Health in Kenya and reduced infections by around 35% over 5 years period. And this partnership foster innovation, accountability, and long-term sustainability. It requires multi-sectoral collaboration. So what has been achieved, we have seen that ART is used, high quality of life, survival rates have improved, vaccination has improved, infections have reduced, and improved training, infrastructure, and supply chains, and reducing the stigma, increased health seeking behavior. People have to seek better health, and this was done in order to reach the sustainable United Nations Sustainable Development Goal number 3, ensuring healthy lives and promoting well-being for all at all ages. So the fight against HIV and AIDS is no longer just a medical challenge. It's a global success story of collaboration and resilience. Life saving. So even the president, Nelson Mandela himself, faced this kind of challenge during his lifetime in South Africa. Over 8 million people are now on ART, with a significant drop in new infections. Of course, people who have affected this have been significantly reduced over a period of time. So this success is due to sustained government commitment, strong NGOs involvement, and global fund support. This program has also reduced AIDS-related deaths by 50%. So people dying have reduced over the last 15 years. 50% have been reduced. HIV, people with HIV positive have been taken care of. Okay, in various countries in Africa. So life-saving treatment has been undertaken by that. So, from crisis to progress, treatment coverage. The Global Fund has reduced HIV infections by 40% in high urban, high burden countries since 2010. By 2023, over 25 million subscribers were receiving this ART. So, 25 million people have received, up from just 1 million in 2010. So, from 1 million to 25 million people, significant number of improvement in the ART treatment. And this growth is a testament to the power of sustained investment and global funding to fight AIDS, along with the partnership efforts alongside all the organizations. So, tracking progress, as you can see on the chart, the 10 countries account for almost half of new HIV infections in the year 2021. To top it all, South Africa, 14%. new infections. Mozambique 6.5%, Nigeria 4.9%, India 4.2%, Russia 3.9%, Tanzania 3.6%, Uganda 3.6%, Brazil 3.3%, Zambia 2.5%, Kenya 2.3%. So, the rest of the world 51%. These only 10 countries have together have new HIV infections, and India is one, two, three, fourth. Fourth is India, and first is South Africa, Mozambique, Nigeria, and then comes India. So we have seen the global data shows a steady decline in the new HIV infections, especially in the regions with strong prevention programs. In Uganda, new infections have dropped by 45% since 2015. And these trends are driven by increasing the testing, improving the better education, expanded access to PrEP. The data confirms that coordinated action and equitable intervention can make the real difference. So you can see the difference here. It was 29 lakhs in the year 2000, and in the year 2021, it has become 15 lakhs. So this is how global funding was required in order to initiate collaboration between partners in order to reduce by half the new infections are halved over a period of 15 years. So to read the caselet number one, Rwanda's community-based HIV was studied, in which they have seen HIV testing increase by 70% in rural areas. More and more people have got tested at least, and treatment coverage was rose from 40% to over 85% within 5 year period. So the success was due to the strong local ownership, cultural sensitivity, and consistent funding. So all three things are required. This case demonstrates how community-driven models can achieve equitable access to care in even the most remote areas. India's youth engagement also. So people, youngsters talk, they have TED talks and various things, and they have taken initiative. So NGOs also doing their best in order to have the targeted adolescents, young adults in urban and rural areas. They use peer education, social media campaigns, school-based workshops in primary and secondary schools to reduce the stigma and promote the safe behaviors. Over 12-month period, the program led to 35% increase in HIV testing among youth and 20% rise in condom use. So this success was attributed to youth-friendly messaging, trusted peer networks, and integration with school curricula. So this case highlights the importance of engaging young people early and involving innovative, culturally relevant tools to drive the behavioral change. So people don't know the marriageable age in certain communities. Some people marry them of younger. Some people don't know when to get them married. So there are a lot of differences amongst all the population, but increasing the education is equally important. And youth engagement initiative has been taken by many various people. What is the first step in managing HIV effectively? First one, early testing and diagnosis. B, ignoring the symptoms. C, only hospital-based care. D, travel restrictions. Okay, let's see whether A is the answer. We'll see the second question, then we'll go to the answer. Second question is, which strategy significantly reduces HIV transmission in communities? First, increasing the hospital beds. B, reducing the awareness campaigns. C, community-based prevention and education. D, avoiding testing programs. Anybody else? Let's see the answers. A. Those who have said A are correct. Early testing and diagnosis is required. Early detection allows timely treatment and reduces transmission risk. And the B question, the question B in which strategy significantly reduces HIV transmission. It will say community-based prevention and education. So awareness and outreach program reduce stigma and promote safe practices. Now coming to integrated approaches to disease prevention, topic 3, and control in low income setting. So health burden disease prevention strategies to integrated disease prevention, role of NGOs, partnership, multi-sector collaboration, integrated approach to health outcomes. So we'll see in low income areas, diseases do not exist in isolation. They are deeply rooted in environmental area and social settings, and economic conditions are helping them in order to again it becomes bigger problem. So for instance, poor sanitation, let us say there is no drainage or there is no gutter in certain areas, there is no proper cleaning of, let us say, garbage collection is not there in certain other countries, certain other areas, and some areas do not have clean water. So, and on top of that, especially in urban areas, overcrowded living conditions create an ideal environment for what? Infectious diseases to spread. So we have to take care of all that thing in order to know what happens in a low income setting, because people don't have money to overcome all this, uh, what can call these kind of conditions. So malnutrition also further weakens the immune system, making individuals more vulnerable. All this exists together and they have to be factorized as to what is the major priority areas in which they have to overcome. So these interconnected factors mean treating one disease without addressing the broader context often leads to recurring outbreaks. So even if you happen to deal with one of the aspects, the other aspects, if they remain, then recurring outbreaks might happen. So health systems in these regions are often under resourced and unable to respond effectively to emerging threats. So a clean and healthy and hygienic atmosphere has to be created. Therefore, one size fits all approach, having knowledge about it is not enough. Integrated strategies is important in order to have essentially to break the cycle of disease transmission. So let us say in Southeast Asia, in some low income countries, they are having poor sanitation. The clean water is getting mixed with the water flowing through other slopey areas from hills. And this kind of water, if it is consumed, it is leading to diarrheal diseases, waterborne infections become common. So the environment directly contributes to spread of diseases like cholera and typhoid. This is prevalent in many areas which are not yet been thoroughly cleaned. So comparing single disease versus integrated interventions. So it's always easier to have a um, ability to treat single disease. In contrast, a well-organized community healthcare center with trained staff and clean facilities demonstrate how integrated systems can function effectively. These centers offer vaccination, nutrition counseling, hygiene education in one place. So just providing vaccination is not enough, or just providing nutritional counseling is not enough. Vaccination plus nutritional counseling plus hygiene education in one place and reducing the burden on families and improving the health outcomes will be able to be done. So integrated approach helps not only one disease such as malaria or any other disease, but they help in order to overcome all these areas which are which doesn't require fragmented efforts basically. So resources are wasted and patients may miss out on critical health services like nutrition and immunization. So in order to get rid of various kind of diseases, integrated approach is required. Now, for example, Himachal Futuristic Community Mobile Health Medical Clinic. It is a CSR initiative by the company HFCL. So these days, many companies have started 2% of their profits have to be spent on CSR, and of course, employee health, safety, and environmental safety and health. Both CSR and ESG, that is environmental safety and health. So all these things will help to improvise the condition. For instance, multiple times of hand washing, provide nutrition advice, bridging the gap between urban clinic and rural population. These units are especially effective in reaching women and children, because women and children, they don't have time to take care of themselves. So somebody have to help them, because if they are busy throughout the day, then they become vulnerable, and they are the ones, if they are affected, the entire family is affected. So women and children have to be taken care to ensure that preventable diseases are not further spreading. So community based health education is one such thing. Strategies for integrated disease prevention. The role of NGOs in integrated approaches. Non-governmental organizations play a vital role in delivering health services where government systems are weak. In certain areas, still the government systems are weak. So they operate at the grassroots level only, but often reaching marginalized and remote communities becomes a challenge because they are all distant communities. NGOs provide training for local health workers, run nutrition programs, and conduct awareness campaigns on hygiene and disease prevention. So the more hygienic the person keeps himself, the more likely he can prevent the disease. The flexibility allows them to adapt quickly to the local needs. Moreover, they often collaborate with the governments and international agencies to scale up the effective interventions. This partnership ensures that the health programs are both culturally relevant and sustainable. So, an example is maternal health now. Nutrition and maternal health is very, very important. You can see curds and yogurts being distributed alongside gifts. In some midday meal schemes are given, and parents are also looking after the children, that the government is doing something during the school time. So these scenes show the NGOs are doing directly undertaking the maternal and child health through the targeted nutrition programs, because whatever the modern day man is eating, no matter what everybody is eating, it seems it is less unless food supplements are given. Iron content and folic acid, micronutrients are increased and help them to prevent the anemia. So anemia condition and improve the birth outcomes. So that is also a very important for the NGOs which they are helping. And NGO intervention, education environment. So health education, for example, the NGO-led sanitation programs where community members build composting toilets because they don't have basic toilet facility. Because earlier, cities do not have toilets. If the women and children want to go for the loo, they don't have. So they have to have sanitation and composting toilets whereby they simply don't put it in lock and key, and and they want to use less water, but it should be meant for the general public learn about waste management. This reduces environmental contamination and improves the overall health. So sanitation and waste management, NGOs will teach the communities about hand washing, safe food handling, disease symptoms occurrence, and knowledge about the disease. This knowledge leads to better health seeking behavior. So multi-sector collaboration in practice. So all the sectors will have to have, so IT sector, NGO sector, rural medicines, nurses, doctors, physiotherapists, okay, and clinics and hospitals. Everybody have to work in accordance with the policies of the international agencies in order to share their expertise and implement the program with a joint initiative, which will help you to drive vaccination along with nutrition and hygiene education, so creating a comprehensive health package for vulnerable population. So case studies we'll see in prevent integrated disease prevention, malaria and malnutrition in Kenya. We have already seen. We don't have again cycle of diarrhea and poverty in rural Bangladesh. We don't have to see again. These are the same cases. So we have seen these kind of cases. Poll question one: why are integrated approaches important in low income settings? A, disease occur independently. B, focus only on one disease is sufficient. C, diseases are interconnected with social and environmental factors. D, only hospital treatment is required. We'll go to the second question. Which is a key benefit of community based health outreach? Key benefit: first, reduces access to healthcare. B, limits service to urban area. C, increases the treatment cost. D, brings healthcare service to the underserved population. Key benefit community health food, health outreach. Let us see. The first one is C. Diseases are interconnected, and social and environmental factors are responsible for such a disease. Explanation integrated approaches will address the multiple determinants like sanitation, nutrition, healthcare together. And here B brings healthcare services to underserved populations. So outreach programs are helping programs to have access, especially in remote areas, enhancing prevention and early treatment. So whole question to us, what does the key benefit means? D. Okay. Brings healthcare services to underserved population. Now coming to vaccine delivery. Vaccine delivery is the biggest problem in certain areas. So vaccine epidemic preparedness, cold chain is required, supply chain, transportation, community center delivery is required. So let's see digital data. So vaccine delivery, as we have seen in some of the previous classes also, it is of immediate importance and on priority. So remote and underserved area, geographical isolation, and in case of distant areas or poor infrastructure, cultural barriers prevent timely immunization. To address these challenges, innovation strategies are emerging, ranging from solar-powered cold storage to drone delivery systems. Okay, so these solutions aim to bring vaccines directly to communities that have historically been left behind. By rethinking traditional supply chains, we can ensure that every child, regardless of location, has access to life-saving medicines and vaccines. This presentation explores the key innovation and real-world impact of both delivery and epidemic preparedness. So we have a cold chain here. We have a truck in which there is a huge refrigerator in which this is a cold chain. This is a mobile cold chain in which in Nepal, health centers in mountainous regions accessibility is less. You can't have a horse riding all the time in order to use only horses because it has to remain cool all the time despite being a cold region. So maintaining consistency in temperature even during outages, this ensures that the vaccine remains effective and safe for administration. So it requires also solar, sometimes off grid. It requires where it has reached GPS system, solar system, refrigeration, everything put together, uninterrupted cold chain management system it requires. And transportation innovation, flying into the future. Drones have to be helped in order to carry. Within 30 minutes, it should be able to reach there, and within hours, if not earlier, it used to take days. So, cost effectiveness and scalability. Traditional vehicles cannot reach remote islands or mountainous regions. Drones overcome these physical barriers to fly directly to the villages, even during monsoon seasons or after natural disasters. So, these vaccines, the community centered delivery approaches. Mobile vaccination camps bring service directly to communities. Local events like festivals or markets are the more area where they can popularize themselves. Like if there is a local festival or a market, or even there's a national festival. So this reduces travel burdens for families and increasing participation. For example, in Nigeria, such campaigns help 95% coverage in hard to reach region. Community health workers who are trusted upon as messengers of peace and wellness, and they are addressing the cultural concerns and building trust in immunization programs. So strengthening public infrastructure. So barriers to vaccine delivery in remote communities, we are having dense forests. Certain areas, very dense forests are there. In certain other areas, deserts are there. In certain region, islands are there, where transportation is difficult because the ships, they are not fitted with all this lift and unlift and load and unload kind of thing for refrigerator and cold storage required. So poor road networks also in some regions, poor roads are there. So now they are able to slowly overcome. Many areas lack permanent health centers. They don't have people who are trained. They don't know the basic language also. Sometimes they don't have the knowledge completely. So, but despite that, they have to help the NGO. So, cultural misconception, fear of side effects, misinformation can affect the vaccine acceptance levels. Okay, and additionally, maintaining cold chain is nearly impossible without reliable electricity supply, because electricity supply is the main important thing in keeping them cool for the refrigerator all the time. So these barriers highlight the urgent need for context specific community driven solutions, especially with the ones which are technology enabled. Cold chain innovation is also important in terms of warehouse. So India has lesser warehouse, whether it is for rice or wheat or potatoes or fish or chicken or mutton, whatever it is. We are having warehouses which are lesser in number. So passive cooling devices like long-lasting cold boxes keep vaccines at safe temperatures. Okay, up to 72 hours without power. So they have to have their own inverters. Because inverters are essential. These are essential during outreach visits in areas with no electricity and poor road also. So supply chain and cold chain are important. Ensuring vaccine integrity from storage to administration. So safety assurance, transparency, accountability. Okay, then they have to have the label 8%. Any color changes, any color has changed, that has to be captured through sensors, and they should be able to send the signals that some percentage has become waste. Because if you use the wasted vaccine, there's no use. So wastages have to be reduced, public health has to be maintained, and information has to flow as to how much has been able to reach due to storage to administration. So from storage to administration, whatever has been used has to be ensured that is documented properly. Now coming to the seaside, now GPS enabled people who have got on ships and all those, wherever they are able to, in case of Papua New Guinea, this technology by understanding help them to reach, improve the missed doses. People used to miss the doses because they are in remote islands. With 40% improved follow-up was required for them. Electronic immunization registries, they are going to register the names, the childs, the women, all those vaccination history is there with these health workers. And they have to deliver in precise, there's like a courier service, they have to come again and again. The money required for them will be supported by the World Health Organization and UNICEF and all those things. And Papua New Guinea is a country in which GPS enabled tools have been used now to access the remote islands for mapping the health coverage. This is for mapping the health coverage. So Rwanda's drone system also they have started, and Odisha in our own country, Odisha have also started community health workers in order to develop the applications from the government and all those things. So outcomes and future directions we can also understand as we go ahead and study a lot more about it as far as these outbreaks of various diseases and integrated approaches are concerned. Coming to poll question now. What is a key innovation improving vaccine storage in remote area? A. Solar powered refrigeration. B. Traditional ice box. C. Delaying vaccination schedules. And D. Reduced vaccine production. Let's try to see the answers later on. Second question. How do drones improve the vaccine delivery? 1. Increase the storage costs. B. Deliver the vaccines quickly to the hard to reach areas. C. Replace the health workers. D. Reduce the vaccine effectiveness. Okay, let's try to see the first. A is the correct answer for first one. Solar power refrigeration explanation ensures the vaccine remains effective in all the areas without electricity because solar power is used where electricity cannot reach. B, in this question, how do drones improve the vaccine delivery, deliver vaccines quickly to the hard to reach area? So drones overcome the geographical barriers and reduce the delivery time significantly. So there is one more topic before we wind up. Strengthening public health infrastructure for epidemic preparedness. Emergency response system, health preparedness, community engagement. Let's say try to understand public health infrastructure. So building resilient systems of public health. So we know some of the organizations like World Health Organization, UNESCO, UNICEF, Médecins Sans Frontières, MSF, and the Red Cross Society. These are all having expertise, funding, training, technical support in various areas around the world. And they are treating and having campaigns for COVID-19, Ebola, Zika virus, monkeypox, influenza, and all such things, including measles, which we began today's class, and malaria also in certain ways. So, epidemic preparedness, all these are the agencies at the worldwide level which help them to develop resilient health systems to support the government. And whenever there's an outbreak, for instance, Ebola outbreak in Africa, disease outbreaks no longer confined to certain areas. They spread rapidly due to global travel. People are moving due to trade. And interconnected regions of modern societies mean a single outbreak can trigger the international response within days. So we have to catch hold of people who have come in contact with one person. That requires early detection, which is critical. The faster a health system identifies an unusual pattern, the more time it takes to act before the disease spreads widely. So public health infrastructure must be agile, data-driven, and capable of responding to both known and emerging threats. Balancing with the not only speed and trust, both are important, not just the speed. So in Indian conditions, if the speed is there, the trust is gone. If the trust is there, the speed is not there. So we have to make a balance out of this. So rapid response is essential during outbreak. Delayed actions allows the virus to gain a foothold in communities, making containment harder and increasing the transmission rates. Effective communication is what is important for us to reduce the fear and misinformation. When public understands risk and actions, they can take compliance measures with preventive measures increasing significantly. Impact of public communication, emergency operation centers. They have to install that, establish it. They coordinate with the flow, allocation of resources, ensure timely decision making. Stockpiling of PPE, that is personal protection kits and oxygen and antivirals, ensure that the health facilities are not overwhelmed during the surges. Training of healthcare workers in infection control and emergency care improves the response of quality and safety. So improve the R&D also important. Significant number of funds is important in order to increase R&D spend, because it takes amount number of years in order to overcome the reality, because they work day and night in order to come up with a new innovation or invention. So laboratories play a crucial role in confirming disease presence during outbreaks. Accurate diagnosis enables the timely isolation, contact tracing, and treatment. So better treatment methodologies can be invented in the future. PCR machines, rapid antigen tests, fast reliable detection, genomic sequencing helps that how the new variants are acting upon the genome of the entire population along with the transmission chains. However, low research countries often face delays due to lack of trained staff and equipment and biosafety protocols. So this calls for investing in laboratory infrastructure, which strengthens the national health security and builds long-term resilience against future pandemics. Then core compliance of public health infrastructure, disease surveillance. So as we have understood that understand disease, how it spreads quickly and to whom it is spreading under what conditions, that's most important for the technology to capture on their dashboard. So enabling faster identification of abnormal case clusters. So where the disease is abnormally spreading, community-based surveillance plays an important role in order to understand local volunteers and suspicious symptoms where people are facing unusual deaths in the early stages of disease spread. So patterns of illnesses with the health authorities have to initiate disease surveillance, the first line of defense. If early warning systems function well, epidemics can be prevented or minimized. In countries with weak digital infrastructure, manual reporting and delayed data can create significant gaps in early detection. Investing in digital tools and community engagement becomes too much required for ensuring that no region is left behind for the early warning process. Fine. I think here I should stop because things more or less get repeated. So let's stop here for today's session. The PPT, in case if it has to be shared, I'll do that in the upcoming class. Currently, it's not in the Google Drive. Thank you one and all for attending the session.